What's going on, everyone? So a question that sometimes comes up from patients is, will my eye reject the ICL? Essentially, will the ICL lead to some bioincompatibility once it's inside my eye? That's a great question, and it's something that's a valid concern. But rest assured, typically we don't have this issue whatsoever, and typically is probably not even the right word to use there. It almost never happens with proper patient selection. The EVO ICL is made up of a material known as collamer, which is a very biocompatible substance, mostly made up of collagen, the same thing our hair, our skin, our teeth, the same thing that all of those things are made up of. So it's very, very biocompatible. And typically inside an eye, the material stays inert. It's not something that leads to scarring over time. It's not something that leads to any decay over time. And it's able to sit in the eyes for decades before eventually it needs to be removed at the time of cataract surgery, typically when someone's in their late 60s or early 70s. Now, the caveat to all of this is if someone has a known history of a lot of autoimmune issues, if they have a history of iritis, if they have a history of other disease conditions that lead to inflammation inside the eyes, then these are typically patients who are either not good ICL candidates off the bat, or they're patients who should know, hey, listen, this is an off-label procedure for you and we should probably do one eye at a time. And if you develop any extra inflammation immediately after surgery that is not going away on the normal post-operative drops, we might need to remove those ICLs so that there's no long-term issues with the eyes.